If you're going for a cesarean section, you should understand what you're going in for. And that is why you'll be given a consent form. And that consent form is not for you to just put in your signature and that's it. That consent form is to help you understand what the procedure entails, what you should expect. It's a form that says that you understand what you're going in for and you're agreeing. So before you agree with your signature, ensure you go through it, especially when it's a planned procedure. You've been planned for a cesarean section, you've been told ahead it's a cesarean section, not an emergency situation. You should go through it as much as possible. So in this video, I'm going to be explaining to you what you're actually agreeing to whenever you're given a consent form for a cesarean section. So if you're going in for a cesarean section, maybe an elective cesarean section, or even if it's even an emergency situation, this is what you're actually agreeing to. If you're being prepped ahead, it's a planned procedure, an elective procedure, you should actually try your possible best to go through it before you agree and pen down your signature on that paper. As simple as that paper looks, it contains a lot of vital information you should actually know about. When it comes to that consent form, it is not the same with every hospital, it is not the same in every country. But there are some major and very important things you'll find in many consent forms, irrespective of the hospital, irrespective of the country in which you're going to be having your baby. As you pen down your signature, one thing you're agreeing is the fact that your baby is going to be brought out through your abdomen. Your tummy will be cut open, your womb will be cut open for babies to be brought out. Another thing you're agreeing to is you're agreeing to anesthesia. And when it comes to anesthesia, it can be spinal, it can be epidural, it can be general anesthesia in which the patient is supposed to sleep. And these different forms of anesthesia depends on what's safe for you and what's going to be best for you and your baby. But in many cases, it's going to be spinal, but in some cases, it can be general anesthesia. It's important to know that when it comes to cesarean section, it's actually a careful procedure and the success rate is actually high. But there are times there are complications, and when you pen down your signature, you're actually agreeing to the fact that there could be complications from this procedure. So that's another thing you're actually agreeing to. When it comes to that consent form, you're also agreeing that some things may happen in the theater. For example, there could be unexpected bleeding and you may need blood transfusion. So you're actually agreeing to some of these procedures that you may need in the theater. So another thing you're also agreeing to is your child's care, your baby's care. When the child is born, what the hospital policy on child's care. Sometimes some hospitals, depending on the hospital policy, they may need to run some important checks on your baby before they hand over your baby to you, before you can start talking about breastfeeding or even talking about skin to skin with your baby. Another thing that you're also signing is that if there's even any issue with the baby that may require resuscitation, you're agreeing that your baby should be resuscitated. When it comes to the consent form, there are so many things you're actually agreeing to. It's not just a piece of paper. So if you're going for a cesarean section, as much as you can, take the form, go through it, understand what the form is saying. Areas you don't understand, ask questions, be clarified on things that are not clear to you. So I hope this is helpful and I hope to see you in the next video. Until then, bye.